Yeah, this is a very promising area of research, and I think, frankly, that's the way of the future. Because IL-2, in one sense, represents the traditional way of immune potentiation and immune stimulation of the anti-cancer immune system in the patient's immune system. And this immune checkpoint inhibitors, as they're called, mainly the anti-PD or PD-L1 therapies, as well as anti-CTLA-4. There is a whole bunch of new immune therapies of that nature coming around, but they're all grouped under this class called immune checkpoints, which are basically brakes on the immune system that are put on by the cancer. So one of the goals, obviously, is to remove that brake so that the immune system can go unchecked against the cancer and mount an effective response. That has already shown very effective therapies in about 25% of the patients in kidney cancer. We know that just doing the immune checkpoint inhibition alone brings about a response or shrinkage in the tumors by scans in 1 in 4 patients. That's 25%. So if you combine with the IL-2, our hope is that they would both together act synergistically and therefore multiply the effects beyond just that 25%. And that is an important point to remember. There's a lot of hype, and some of it, or most of it, I would say, justified in the immune checkpoints. But you have to remember that 75% or 3 in 4 do not respond to the immune checkpoints by themselves. So there's clearly a big area of unmet need where we have to convert some of the 75% at least to respond to the immune therapies. And the way to do it would be combinations, including with IL-2, high-dose IL-2. So along the lines of this discussion, we are currently conducting and are enrolling into a study of high-dose IL-2 followed by nivolumab, which is one of the anti-PD-1 drugs made by BMS, to do exactly that. So IL-2 mechanistically works in the earlier part of the lymphocyte proliferation, the immune cell multiplying, whereas the immune checkpoint inhibitors are kind of towards the end. Instead of turning off the immune system, we would keep it going by using these checkpoint inhibitors. So together, theoretically as well as hopefully on the clinic side, we will see a synergistic action where we will have higher responses and, more importantly, more potent immune responses.